Yay, we're here. So how do we love the fireplace? I was showing you, Kim, before we jumped on.
I was saying it's giving a vibe. I'm in favor. I'm feeling very cold over here.
Dude, has it been cold up there like it has been down here?
Yeah, freezing. Like not East Coast freezing, but California freezing.
I know, it's so funny because I always feel like you and I can talk about California freezing, but the second that people are watching from like other countries and people are watching from like other states, they're going to tell us to be quiet because I'm like, oh my God, it's freaking, let's see, 56. 56 is cold.
That is cold.
People in the comments are going to say 56. That is not cold. Welcome, everyone. Hello. Welcome to this beautiful Wednesday. As you know, every Wednesday at noon Eastern are here on the West Coast with Kim and I. It is 9 a.m. and we are excited to have another special episode of the Ask the Experts. As you know, every third Thursday, I am blessed with my lovely co-host, Kimberley Quinlan. Super excited to have her on. And this is really about you. We always say this, but one of the reasons that Kimberly and I do this is because, you know, so many people out there don't have education or community or resources, or they're waiting on a wait list to get help, or they're seeing somebody that isn't a professional in the OCD space and just need some guidance. And that's really what we're doing here is we're trying to get you guys just the best information that we can provide. We obviously can't provide therapy as well as we can't provide any kind of services if somebody's in in any kind of crisis. So obviously what we want you to do is if you're in a crisis situation right now, experiencing suicidality or anything of the like, please dial 911, go to your local emergency room, or dial 988. You can also go to 988lifeline.org, or you can find a mental health provider. Go to iocdf.org/find-help. So really make sure that you're taking care of yourself. But what we can provide is a great live stream where we're answering your questions, giving you direction. So we know that we are broadcasting right now on Facebook, on LinkedIn, on YouTube, on Twitch, on X, and iocdf.org/live stream. So wherever you're watching us from, there is a comment section. First and foremost, I always love to know where is everybody joining us from. So just kind of let us know. Where are you at? What are you watching this from? Also, are you somebody with OCD? Are you a friend of somebody with OCD, a parent, a grandparent? We'd love to hear where you're at. Shout out to everybody that is either at, I don't know what time it starts, but either at or going to be at the Faith in OCD conference, which is today. So shout out to Katie O'Dunn. Are you speaking there?
I'll be speaking at 11:30.
Oh, okay. Well, this is perfect. You got to hang out with me and then go speak to them. So shout out to Kimberley Quinlan as well as Katie O'Dunn and all the great speakers, Justin Hughes. There's so many good people I saw in the lineup for the Faith in OCD. So if OCD impacts your faith, if OCD impacts, scrupulosity, etc., this is a great conference. I don't know if people can still register, but you can at least check it out and get information and find out what is next. Maybe you can purchase the recordings afterwards. Also, if you head over there, there is a December 13th summit. It's a day of CEs for professionals. There's going to be CEs on law and ethics, working with marginalized groups, working with migrant groups. Also, there's going to be talks on other types of interventions for OCD, like metacognitive therapy, ACT therapy. There's going to be panels. It's going to be a great time. So a lot of people that I respect and love are going to be part of that. So hopefully you can join. Other than that, we're just happy to be here. Kimberly, why don't you introduce yourself and say hi to everybody?
Hi, everyone. My name is Kimberley Quinlan. I am an OCD therapist in Southern California. And I also am a podcast host, an author, and I'm also a human who has OCD. So there you go.
And my name is Chris Trondsen. I'm a licensed therapist that treats OCD, body dysmorphic disorder, and related disorders in Orange County, California. I also am on the board of directors for the International OCD Foundation. I lead some of their special interest groups. I'm also an IOCDF advocate, along with Kimberley Quinlan. And then I am vice president of OCD Southern California. And we just hosted a conference. We're one of the official affiliates of the IOCDF last weekend. Kimberly, you were there. We had 1,355 people sign up. We've had some people sign up for the recordings. People can still watch the recordings back if you'd like. Go to ocdsocal.org and you can go ahead and find out how to get the recordings because they're going to be available for 60 days. But how was it? How was it to be with
Oh my gosh, it was on fire. Literally the most excellent speakers. The coolest crowd came, and it was at the most reasonable price. Like, I was just mind blown on how you did it, Chris. It was a work of art. It was ran so beautifully. There was barely even a hitch. And the speakers were just so wonderful this year. It was just the best vibe of just kindness and education and love and laughter. It was on point.
Oops. Yeah, thank you so much for saying that. I mean, you spoke and people loved everything you had to say. So if you want to get the recordings for 60 days, you could just log into there. It's low cost. Go and check it out. You can get the recordings. But Kimberly's being humble. She had some really awesome programming there. She was part of a lot of different talks. People really we already had about 20%, I think, was the last number of people fill out the evaluations. We just sent out another request for people to fill it out. So we had people saying great things about Kimberly. We had some great talks. I really enjoyed the procrastination talk for people with OCD, autism, ADHD, and anxiety with Melissa Mose and Jenny Cuckerts. I got to watch your talk on how to incorporate self-compassion with Aaron and ERP. I was able to see the body dysmorphic disorder talk with my good friend Scott Granite and Robin Stern, and I saw the perinatal talk with Mary Spinagle, and so just a lot of good people. So if you want to hang out there, if you're going to the conference today, the Scrupulosity, the Faith and OCD conference. I always call it the Scrupulosity conference because all my clients with Scrupulosity, I have made sign up this week. I was like, you guys need to go. This is going to be a conference for your subtype. And it's more than that too. Faith is a huge part of what helps drive people to get better, and our faith can get impacted by mental health, and that's really tough for a lot of people where faith is important. And instead of being able to appreciate it, just like relationship OCD ruins relationships, just like contamination ruins travel, there's a lot of ways that OCD impacts just the general way of being.
Yeah.
We also have some pre-submitted questions. We got some questions from the big wrap-up panel. We have some questions showing up. So hang out with us for the next hour. We're just going to have a good time, answer your questions, and talk all things OCD. And Kimberly, was there anything that people asked that you think would be a good opening topic? Was there anything from the conference or the chat? I'll throw out one while you're thinking of one. I did a talk with Liz McInville and with Michelle Massey, and it was about really helping your loved one get autonomy and helping your loved one be independent, and that so many people get fragilized with OCD. But it made me think, and I had this talk with my group last night, OCD is such a fragilizing disorder. It has us start to believe that we can't go grocery shopping on our own, or we can't travel, or I think it's great when people get accommodations for school, but it makes us feel like we need it forever. And we're always going to need accommodations, which usually has people not strive to their strengths. So what are some ways that people with OCD, or if we have people watching that are family and loved ones, can start to get more independent? Because I do think OCD kind of gives us this sort of learned helplessness and prevents us from really being autonomous.
I think the first thing that crosses my mind, and it's not the main answer, but it's just sort of the thing that I've found to be really effective, is to practice doing little baby things on your own. I know that sounds very like well, duh, but it's surprising how much we get comfort by just knowing someone's in the room, or someone's by us, or someone's around us. And a lot of my clients, we have found even simple things like, I just want you to go to the store by yourself, or I want you to go to a neighborhood that you've never been to, or go to the movies by yourself. Even if it's not related to your obsession, just practicing and making a deal with yourself every day, every week, to make sure you're doing something by yourself that you usually wouldn't do by yourself. I think it gives a sense of independence and autonomy of oh my gosh, I can do it. And it helps to sort of reinforce this idea of I'm actually way more stronger than I thought. Now, of course, that's not the only thing, but I found a lot of clients who committed to that did really, really well.
Yeah, I think one of the things when I think back to my own journey with OCD, or I see in clients a lot, there's something about being able to reclaim certain things that had once been a passion and something you enjoyed. And then OCD sort of took that away or made it difficult. And through treatment, being able to then reclaim that again, I think that is super, super important, because So I'm going to turn off my notifications. I forgot to do that, and people
That
are
was
messaging
mine.
me. Oh, it was yours? Okay, I thought it was mine.
No, it is yours. For a second, I thought it was mine.
Oh, but yeah, I mean, I really think there's something about accomplishment. I remember reading an article that came out from a neurologist around the pandemic on why it was so difficult for people from a science standpoint. And they said the brain loves to continue to learn, the brain loves to achieve, accomplish things, problem solve, overcome, and it makes it feel like it's doing its job, and it kind of rewards us with feeling good and courageous and independent. And a lot of times OCD takes that away. We're not able to work, or we need family support, and it's okay, and it's not a bad thing. And there should be a goal of trying to get that independence so that you feel good. You're like, oh, I'm able to go back to work or volunteer. I remember when I volunteered and I was able to make it each day and I was able to do my responsibilities. I remember it was only one thing in my life after treatment. I was doing nothing but volunteering, but I was so excited to yap to people about it because I was like, oh my God, I'm doing this thing and I'm playing with puppies and it's so amazing. So I think it's just, I was saying in the talk, like a culture of independence. You know, you have to start to get into that mindset of like, how do I reclaim sort of those moments of strength and independence versus letting OCD kind of fragilize us to thinking we can't do anything.
Agreed.
Was there anything that came up in any talks or any clients or any groups that you run or any podcast comments that you're like, oh, this would be good to chat about before we jump into Q&A?
I think that the most joyful moment of the conference for me is we did a talk on making OCD treatment fun. And we were really careful not to make it sound like, oh, it's just so easy, right? But it was such a great crowd. And we were all talking about little creative ways to implement fun into treatment, and the chat was going crazy with ideas, and we were giving lots of ideas, and we did a bunch of examples of how to sing your obsession and how to play one-up games and how to do craft exercises or cooking exercises with your obsessions. It was such a great sort of refreshing, right? Like we talked a lot in the conference about like the real science and the real nuts and bolts, but it was really just fun to be like, everyone put your obsession in the chat and let's come up with an idea on what you could do for your own. It was just so fun.
Well, I love that you guys did that talk because I think there's this old belief system, and I think it's sometimes perpetuated from people that haven't gotten treatment recently, or even some providers trying to negate the positive effects of ERP for whatever intention. And you know, I think back to the treatment that I did, and it was fun. You know, I had this. You know, I hated eating food with my hands. And so we went to El Torito. It was like right like next to where I got treatment. And, you know, I'm like eating chips and, you know, like just at a Mexican restaurant. And I'm like, oh, this is going to be cool. Like, obviously it was fun to do with my therapist, but I'm like, I can't wait to do this with my family and eventually make friends and like just be at a restaurant or, you know, I guess it wasn't fun, but I had a fear of lotion because I had such cracked hands from washing my hands. And my dermatologist said, you know, it was like a little comment on the way out. And she's like, oh, and make sure sometimes people keep lotion around for like 10 years. Make sure that you check an expiration date because you're putting on lotion. You don't want it to be old and get an infection and like lose a finger. And she's probably making a joke. But my brain was like, oh my God, if I use lotion, I'm going to lose a limb. And I'm like, I can't, you know, I was like, So I just wouldn't use lotion, but it went further and further. I wouldn't be around people that wore lotion or shake hands or hug or whatever, just in case. But, you know, it was like, we got to go and pick out like what smell I liked. And I remember it was some kind of like lemon and just like put on lotion. And it was like, oh, okay, this isn't torturous, right? So I love that you guys talked about that because treatment should be learning. It should be fun. It should be values-based. And I love that you guys talked about that. Here's a good question. One more question. Does sleep significantly impact or affect OCD, increasing intrusive thoughts? Does getting adequate sleep have a major effect on improvement?
Yes. This is such a good question. In fact, I did a whole podcast episode on this recently. I know for me personally, I will start with sleep is almost a direct indicator on how well I cope. If I don't get a lot of sleep, I am way more anxious. I'm more teary. My ability to use my skills is so much less. And that's someone who knows the skills and has practiced them over and over again. So sleep is a huge piece for me. It's in my case, a non-negotiable, meaning like it's priority over almost everything. We have a lot of research to show that there is a huge overlap between really low levels of sleep and high levels of mental illness, especially anxiety and depression. And so, yes, it's very important. However, I want to stress to you, if then you hear that and you're like, oh, I have to get sleep, now I'm going to have a mental illness, even worse if I don't. Remember, if sometimes our need for sleep can become an obsession in and of itself. And so if you're feeling that, we actually want to just take the pressure off and say, even if you're not sleeping, as long as you're resting, and you're, in the dark and you're taking your time and using really good sleep hygiene, well, then that's the main goal.
Yeah, and what I'll just add to that is, I did a talk at the conference this year, and we're going to do another part to it, probably my family group in January, but about the positive impacts of sleep. I have 2 sleep disorders, and because of that, I've had to take sleep seriously and got CBTI trained because I was like, hey, I should probably be using this on myself.
Yeah.
And one of the things that happens when you don't get great sleep is your body kind of dumps like a lot of levels of cortisol in the afternoon and evening. And so there tends to be people that don't get good sleep will notice that they're very, very anxious in the afternoon and evenings, unexplained. It doesn't always have to be from a trigger. And then that can help, or that can prevent us from like relaxing and calming down, which can make sleep bad and becomes a cycle. I agree with what you said. We cannot get to a point that we allow OCD to then take and hear this and have you panic, because that will lead to no sleep. What I like to think about is it just needs to be more of a priority for us. Other people can, go out on a binger in Vegas and get an hour of sleep and pop up the next day and like call their bath, jump in a pool and call that their shower and like start, Vegasing again. It doesn't mean you can't do that. It doesn't mean that if you do that, it's over for you. It just means that, man, you will notice the difference. And everybody's different. I've had clients where they can get bad sleep and they're like, yeah, it impacts me. And I've had other clients where it's like their thoughts are just rapid the next day.
Yeah.
Same with alcohol, same with, anything else. So you just gotta know yourself.
Right.
Yeah. Lewis said the same thing. Sleep affects mood and worsens drastically. Sleep always impacts mood.
I'm with you. That is so me. I am my ability. It's more that my ability to use my skills is so much lower.
Yeah. Oh, Lewis said a nice thing about the conference. Yeah. So how can someone find help in the UK?
You might want to be the best answer for that. I mean, I always refer people to the IOCDF therapist directory. That's who I will often have people go to find people in their local area.
Yeah, Amy. So I do a couple things. I'd go to iocdf.org/find-help. I would put in your information and kind of find, a provider near you. Stuart Ralph, who's incredible. He hosts the OCD Stories podcast. He is a treatment provider in the UK, so he may be able to support you or, know of somebody who can. I also know that there's OCD Action, I believe it's called, in UK, and they may have some resources. So I'd start with our directory. If you find someone great there, I don't even think you need to worry about it. If you don't find anyone there, then what I would definitely say, look out for those resources. Like I said, either OCD Action, Stuart Ralph, who has a treatment center in the UK. But hopefully you can find some help. Also, I'm going to plug a couple different things for you as a parent. First and foremost, the IOCF has live streams for parents. It's actually sponsored by Kim Vicente's nonprofit, Jack MHA. I always want to say Jack Maha. So I would check out the live stream. I don't remember the date of the next one, but I saw a flyer for it. So go to iocdf.org/live streams and you'll see the next live stream for parents. Also, I run a free family and loved ones support group every second Saturday of the month from 11 to 1. I'm going to put the email in the screen. I'm always terrible at doing 2 things at once. But if you head over and email us at info@ocdsocal.org, there's a lot of good resources there. But we have a free family and loved ones support group every second Saturday of the month that anyone could join. What other books do you like for families, Kim?
So there's two. John Hirschfield has a book called When a Family Member Has OCD. And then there's a new book on, and you might need to get me the exact name for it, Chris, but when a family member refuses treatment.
Yeah. When a family member refuses mental health treatment from Alec
Yeah.
Pollard. Yeah.
Yeah. Yeah. Two really, really great books.
Yeah. So definitely, and hopefully this live stream supports you as well, Amy. Ash says, what advice would you give to someone who's new to the OCD community but struggles to interact for fear of imposter syndrome? How can they connect?
Well, I mean, all I can say is if you're new to the community, you're going to do really well. I mean, this is a little bit paradoxical, but the community doesn't need anyone to come in with uber confidence. We're all coming in with our own strengths and weaknesses. I think that if you came in as, with just a genuine wish to be a part of the community, that's all you need. You don't need to be a professional. You don't need to know a bunch of stuff. You don't need to be overly confident. In fact, sometimes that's not helpful to come in super uber confident. We're all here just doing the same thing with the same goal. I think if you genuinely want to help, you will fit in beautifully. So I would just remind yourself of that and just gently use it as an exposure to step in and let your imposter syndrome just be there.
Yeah, I think what happens is, I think a lot of the work that you do with self-compassion as well as your book can really help, because typically what imposter syndrome is that there's an expectation you have that everybody else is doing this thing. And so what I hear for a lot of people, whether they're therapists or advocates or people presenting at conferences, they'll always say to me, they're like, can you give me some tips? Like, I feel like an imposter. You've done this all the time. Like, this is my first talk, da 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 da. And it's like, did you guys think that my first thing I felt confident? No, we all kind of second guess ourselves. Yeah. I think there's this false idea that in order to support others, you have to be 100% cured. And so to me, there's just a lot of recognizing that, it's because we're usually comparing ourselves to others or comparing ourselves to an expectation. For you, Ash, or for anybody else, like, everybody has something, right? We need more people talking about OCD who are people of color, who people are in, areas of the country that there are no treatment centers, people that are international, where there is no resources in their country. We need people that are parents. We need people talking about OCD and getting diagnosed after 65, or, kids and parents. There are so many corners of this community that don't always get vocalized. And so everybody offers something, and there's something that you offer, and people just need to hear and connect with others. So always just trusting that you're enough. And those doubts, what I like to think about doubt sometimes, when your brain is like, oh, should you be doing this? Like, imposter. It's just a suggestion. You can either take it or not take it, but don't let it mold the way that you act or behave.
Yeah.
Yes, Stick with the Ick is a great resource for scrupulosity, definitely. This question, I think, was when I was talking about the summit. Yeah, so the summit is talking about adjunctive treatment. So I believe it's going to be ACT, ICBT, metacognitive therapies. And then I think there's 2 panels. So definitely check that out. If you go back to, I believe if you go here, you can look at all the different offerings of that event. There was another, I'm going to put up a pre-submitted question. Any good ideas how to help myself to prepare and succeed when I enter into a 24-hour residential OCD treatment program that I won't be able to start for another 4 months due to a waiting list? So how can people sort of do some readiness to get ready for going to a residential?
Yeah, well, number one, amazing work in committing to that. I'm sorry that there's a long wait, but I'm just in awe of your courage of doing that. I think it's going to be wonderful and so helpful. I think that the thing in terms of preparing yourself is, I would read some books on OCD. I mean, you may already have information, maybe you've already been through treatment, but just keep dabbling in the main concepts so that you feel like you're really, mentally prepped. I think the other thing is, start to think about ways in which you can support yourself like as a coach, because a lot of that is going to be mindset. So, working on being a kind coach to yourself, working on your self-compassion, working on another thing is like managing your sleep and having a good routine ready to go, because it will be an adjustment. But I think also don't over prepare. They will have a whole system ready for you. You're there to let them help you. So I would just focus on being with as many loved ones, keeping your routine as steady as you can. But again, super massive respect to you for going.
Yeah, and I think too, if you don't already have an individual therapist, think about that, because I think that having an individual therapist and just kind of getting ready. I think that's something I do a lot. We'll have people, if they're waiting for one of the big residentials, they'll come to our IOP. And it's good because in the IOP, we can do a lot of education. We can get them really understanding what their symptoms are, what their obsessions, compulsions, have a good understanding. And what I hear from residentials when we send them there, they're like, oh, they're hitting the ground running. So that can be super, super helpful as well. There was a comment. It's always sweet to hear these things. Where did it go? Somebody said amazing conference. So thank you, Betsy. And then, yes, Ash. So people can still get a ticket to watch the recordings. They're going to open up this Friday. And if you just go here, you can purchase a ticket and then watch all of the recordings back for 60 days. So we hope people can join us. We want people to be able to access that, even if they weren't able to be there live. There was a question here. Is it okay to do a compulsion once to test if I can only do it once without going into that downward spiral? I've been able to do this successfully a few times.
Well, ideally, we want to reduce and remove compulsions. That's the ultimate goal, is to be able to have an intrusive thought or an intrusive feeling or a sensation or an urge or an image, and be able to willingly tolerate that discomfort without engaging in any compulsions at all. Because when we engage in compulsions, we kind of feed our brain this idea that the obsession was true and important. However, there are times where something that you were doing compulsively, you need to do, let's say like having a shower or brushing your teeth. And so if you're having to do something that was a compulsion, but you need to practice doing it so that you don't engage in repeating it, that would be great. But I wouldn't usually encourage people to test compulsions to see if they can maintain it. The only metaphor I would have, which is not a great metaphor, but that would be kind of like saying, if you're an alcoholic, like have one drink and see if you can just stay on one drink. And some people can, that's fine. But I wouldn't recommend that unless for some reason there was an important thing that you needed to do. Now, another example I give of this is, let's say I have had clients in the past that were pharmacists, and a part of their job is to actually check things 3 times. They are supposed to check the medicine before they hand it over 3 times. That's normal standard, industry standard for them. And so in that case, I wouldn't call the checking a compulsion, but anything more than 3 times would be the compulsion. And that's, again, I wouldn't recommend that. So I hope that nuance is helpful.
Yeah, and the only thing I'd add is like, unless it's planned with you and your provider, right? So let's say somebody is every time they get out of the car, they have just right feelings. So they'll get out, go in, get out, go in. And let's say, your good number is 20, right? So you do it 20 times. If you and your provider decide like, hey, we're going to cut it down to 5, like, that's different because it's like a plan thing. Yeah, it's a plan. It's sort of, your brain knows, hey, this is why I'm still doing it 5 times. As Kimberly and I like made that plan. We're going to track it. We're going to come in. We're going to look at data. We're going to look at if we could knock it down to 2 times and then once and then eventually not. But the hard thing, man, is compulsions are addicting. Like it just feels so good to do. And I think that's why we get stuck on them, is because it's like, oh, I could just do this once. I can just do this once. I'll wipe this down once, or I'll pray once, or I'll ask somebody to repeat themselves once. And I've just not heard people saying, hey, I always cap it at once. I always hear people saying, oh, I did it once and then I started doing it twice and then I had a bad day. And so just want to be careful, Robert. want to be careful. This question I'll toss to you. I've been trying to start journaling to get off intrusive thoughts, but every time I start, in my mind is filled with thoughts like, what if I write these thoughts down and they are now real?
Well, I think this is an opportunity for an exposure. So it sounds like what you have here is a little bit of magical thinking, which is really common with OCD. I very much resonate with this. And so it sounds like your OCD has a rule that writing things down might make them more likely to come true. And very easy trick to fall into. Now, I love the idea of you writing a thought down as an opportunity to face that OCD. In fact, I would do that with my clients all the time. If they have something, this magical thinking, we try to experiment, like we'll do a scientific experiment and see. And sometimes we try to make things like, I remember when I was first training as an OCD therapist, we used to be in an 8th story right over like the busiest part of Los Angeles, Barrington and Wilshire. It's like accidents there all the time. And we would practice standing at the edge of the window and try to make the cars crash with our brain, right? Like to see if we could. And what did we learn? Our thoughts are not that powerful. Now, there were the one time where like there was a crash and then we had to keep practicing it, right? Because there's crashes there all the time. But so in that case, I think it's a great exposure. On the flip side, I usually don't, and Chris, you might have a different way of doing this. I don't usually encourage people to journal intrusive thoughts unless it's for an exposure, because often if you're journaling on intrusive thoughts, you're just giving them more importance. It's different if you want to journal about like, how you're feeling about something non-OCD related, or you're working through a decision that you have to make that's not OCD related. But I usually try to allow thoughts to be there while you engage in your life and your joy and your values. If you enjoy writing, maybe write a short novel or a poem, but I usually do not encourage people to journal intrusive thoughts.
Yeah, I don't either. I mean, I think one of the main things that we're trying to teach you in OCD treatment is that thoughts are just thoughts. They're passing moments, little, buzzes of energy of time. And if anything, we do the problem that people with OCD do is we give it so much attention and so much time. So if you're sitting down and having to write out all your intrusive thoughts, to me, A, what would be the purpose? But B, now you're kind of keeping these thoughts around you. Now, I will say, like, I journaled during my treatment, but it wasn't about my intrusive thoughts. For me, it was really one reason was when I got on medication. It's so hard because you see your prescriber like every 3 months, and you might be feeling great that day, but forgot that all last week you're having horrible moments and need to go up. So for me, journaling helped me kind of I would look at my entries for the, on average for the 3-month period and be able to come in and say, hey, over the last 3-month period, this has been my average. Also, for me, it was like I journal my successes so that when I would have those low, hard days, I'd be able to flip back. My mom was good at saying that. She's like, let's look at your successes. And, I journal a lot of them down. So I think that's more important. I still have all my journals. I'm kind of looking at them behind my screen. And, I am glad I wrote my experience. But when I read them back, it was never like, I had a thought I was going to do this today, because I think it's just giving them energy and meaning. And we don't want to do that.
Yeah.
I love this from Ash, for making exposures fun, being evil in The Sims, or letting patients die in 2 Point Hospital. It can be so big to have exposures for the lower levels like this. Yeah. Just making it fun. I had a client who, some good exposures, not Imposter, Among Us. It was that game that came out during the pandemic where you were like the imposter and you'd have to go around and kill people. And because of their moral screw, not like really kill people, and it's these stupid little cartoon characters. It's like a fun game. But my client, like anytime they were the imposter, they'd quit the game and restart it and quit the game. And then it was almost like the algorithm knew, because every time they quit, they'd come back, and it was like, boom, And so that's what we did in session. And he loved it, like playing imposter and like having to like lie in the chat. It's not me. Because we had a conversation about the difference between like, these are the rules of the game. You can play the game, and that doesn't mean that you're going to suddenly do that over there, but let's experiment it. Let's see if OCD is right with its threats or not. And quickly she was able to realize like, okay, this has nothing to do with my real life. Mohammed asks, is it possible to recover with OCD, especially the way that I took this last part is to be able to handle stress the same levels as people without OCD?
1000%. Yeah, we see this every day. I really want to encourage you, like 1000%. OCD is a very treatable condition. And so, yes, yes. Now, does it mean that it takes time and you have to put in some effort? Yes. I mean, wouldn't it be great if we didn't have to put in effort and we sort of just somehow magically got rid of these symptoms? Absolutely. But it does take some changing and some rewiring and some new ways to respond to things. But 1000%, yes, please. I want to, if you leave with one message today, is like Chris and I are, living, walking evidence that you can recover, and not only just recover, but have a good life, right? Be happy, enjoy, have joy in your life. And again, it's 1000% possible.
Yeah. I mean, Kimberly and I are both living proof, and there's a lot of advocates that are living proof. There's a lot of people sharing their stories that are living proof. If you listen to Kimberly's podcast, Your Anxiety Toolkit, you'll hear a lot of different people sharing success stories. A lot of people get better. I remember when I was doing my thesis and looking at some of the meta-analysis and, showing things like 70%, 80% when people take medication and treatment. NoCD came out with a study of all of their members, and it was like 80% of people saw significant recovery. You add medication or a high level of care, and that number goes up at times. And my point is, like, I used to think like, oh, that's not too high. Why isn't it 100? And then when I was in grad school, I remember hearing about other disorders like personality disorders. It takes a lot harder and not as many, people covered, or, people on average have to go to 9 rehab centers before that they, become sober from substance use disorder. So we have some really good numbers. I think the cool thing about treatment too with ERP is you get to decide how much quicker you get better. So if my therapist is saying, I want you to be able to go out in public and be around people, and you're going to have harm thoughts, great, but let's not, act like they're real and run home. Like, let's spend time out. If I choose to leave at the morning at 10 o'clock and I'm around people until 9 p.m., I mean, that's going to be some significant data collection that those things didn't happen, and I'm going to thrive and feel good. So, the more work you put in, the better you get better, quicker you get better. Colleen asks, what is the best way to help a person who is stuck in mental rituals without upsetting them?
So the first thing I would say here, and maybe I'm not answering your question directly, but I think the first thing is actually to talk with them on how they want you to intervene. Because if they're adamant, like, I don't want to, I want to do my mental compulsions, yeah, you will upset them because they don't want you to intervene. And so I would first talk with them. Is there a code word that you want me to use? Or is there something I can say, like, how can I support you? Or, don't let OCD, take you down. Or if it's just a gentle wink, it doesn't have to be words even. It could be body language or an action. So talk with them first. Now, if your loved one doesn't want you to intervene, well, there's not a lot we can do. If your loved one is then engaging you to wanting you to engage in their OCD, that's when you can set a limit and a boundary and say, listen, I love you, but I'm not going to let OCD win. But I usually, especially if they're an adult, I usually wouldn't encourage you to be intervening if they don't want you to. Now, if it's a child or your child, well, then, yeah, you can continue to work on rewards or games or ways that you can intervene in a way that they agree on. But again, sometimes it's okay if they're upset too, right? Like, we're not here. It's not a perfect world. We can't expect people to be happy that you're intervening when they're stuck in a mental compulsion.
Yeah. I think that's what's tough is that, I know you want to help. And I think the other thing, what I'll add is just having a conversation outside of the moment that the person is stuck and create a plan, and making sure that plan is created when both parties are calm. I'm guessing, Colleen, and you could correct us in the chat, but I'm guessing this is for a loved one. The problem is that people don't ever kind of create a plan when they're calm. So in the moment, obviously your loved one is like asking for reassurance, or maybe the opposite, leave me alone, you're making noise, stop. And then you feel like, what do I do, and tiptoe. And so one of the things that's really, really good is kind of creating sort of like a family contract and just saying, okay, when you're stuck in a mental ritual, what is my role? Now, my role can't be answering questions or trying to get you out, because that's not how the treatment works. But what do you want me to do or not do in that moment? And are you using the skills that you're getting from your clinician or your self-help book or from the live streams, et cetera, on how to handle it? Because you want to kind of create a plan, because as a parent, your role isn't to deliberately trigger them, right? That's not the goal. But it's also not to try yourself to get them unstuck, because that doesn't work either.
Yeah.
Tanish asks, mental contamination OCD has taken so much control of me. I can't go out, and I go, my mind will be, and if I do go out, my mind will be noticing even at the smallest thing and make scary stories up about it. It causes waves of terror.
Yeah. I've been answering them all. Do you want to answer one, Chris?
Yeah, I'll start, and then you could add to it. One thing that happens in contamination is we track. And so when we go out, we scan. So what that would look like is, let's say you go out, you might be scanning the ground to see what you're going to step on. You might be scanning who's touching what. You might be scanning what your family members are touching, because then you feel like they're going to touch you, etc. And then when you're tracking, or when you're scanning, you're going to notice things and then track it. So, okay, well, my dad touched this off of the shelf, and then he touched his wallet and then his keys, and then the keys, he turned on the car, and then he went and he patted me on the back, and now all that stuff is on my back, etc. So one thing that you learn in treatment is you start to learn kind of, like the way that OCD tricks us. And I did a talk on different OCD kind of rules that I've helped create with clients, because I started noticing myself and others just have no kind of sense of grasp on how contamination works. And I created these rules, and I presented them at conferences that have come based on like science and instead of sort of like what our mind makes up. So, part of what I have clients do is like, when we go out together, let's not scan, pay attention to me. Let's have a conversation, right? If I touch something or you touch something, your mind's going to want to track it. Let it go. It's like, yeah, I did touch it, and it may track, it may not track. I'm not doing this anymore. But with a contamination OCD, we have this idea that everything's invisible. We touch it, we spread it everywhere. And then either we're going to feel disgust until the day we die, or we're going to get a disease, etc. And start small. You don't have to go to a concert tomorrow. It could be as small as like getting the mail out from the mailbox, or going to your car and walking back into your house. I think sometimes people hear us and think that you have to be, cured by sunset. It's like, no, it took me 2 years to get to a point that I could volunteer and get a job. So take it at a pace that's best for you.
Yeah. One of the skills that I found the most helpful was a skill called attention control. I did a podcast with Max Maisel on attention control. So I think if you Google Kimberley Quinlan attention control, it should come up. But ultimately, it is the when you go out, because of your emotional contamination OCD, your brain is like Chris said, like it's constantly scanning for danger. And so it is a muscle that we have to strengthen, just like a bicep that we strengthen if we're doing push-ups, is to be able to have attention control. And what that really is it's not like a compulsion. It's noticing when you're scanning and bringing yourself back to something, whether it be the present moment or the action you're doing. And this is hard work, right? Like this is like the equivalent of doing push-ups. I don't know, I can do like 15 push-ups, but I'm trying to get to 20, right? Like, so it's hard work. It takes a lot of practice, but catching yourself and having the awareness that you're doing it, and then bringing yourself back to something present, then your brain's going to say, oh, but what about the next thing, right? It's going to take you on to the next OCD obsession, and you're just going to keep bringing your attention back. And with time and practice, you will strengthen that skill.
Yeah. Colleen said it is her 18-year-old son, and Ash agrees. Don't talk about it when they're in the throes of the cycle. It's really hard to plan when somebody's dysregulated. Mm-hmm. This one says something nice about you. Yes, I would start writing about the good things about me and my genuine feelings. I really get a cheerful vibe from Kimberly. Thanks. Yes, she's super, super sweet. But yeah, this is a good way to journal. We don't want you to hear from us not to journal. Just journaling just your intrusive thoughts won't be great. This is a good one from Jenna. Can stress cause relapses?
That's a good question. Yes, but let's actually go a little deeper. Yes, there are certain things that can trigger an increase in intrusive thoughts and obsessions. Stress is one of them. Lack of sleep is another one. Hormones and different hormonal stages of your life is another one. Infection is another one. But for some, it's just Tuesday and your OCD decides to flare, right? So yes, they can cause an increase in obsessions, but I don't think that is the direct thing that causes the relapse. What we want to look at here is you will have seasons of your life where you have increased intrusive thoughts and obsessions. Often around really important events too, like maybe you're getting married, or maybe you're having a baby, or maybe you're studying college or something like that. So I wouldn't say it's the stress that causes the relapse, because what we know is increase in intrusive thoughts doesn't mean you have to relapse. What we want to then look at is when you have intrusive thoughts, how do you respond? Do you go back to your normal old way of doing compulsions to try and reduce or remove that intrusive thought or intrusive feeling, or are you engaging in your ERP? So I would say yes, that stress does have a relationship with relapse, but I don't think it's the actual cause of the relapse.
Yeah, the only thing that I'll add is just basically too is that, it's hard to relapse. That means you almost like abandon every single tool your therapist gave you, et cetera. Can we have slide backs, lapses, hard days, et cetera? Going back to the journaling question, I think that's why journaling can be helpful if you use it in that manner, is to remind yourself like, wait, just last week I was writing about how I was so excited I went on vacation with my friends. I'm not having a relapse because today is hard. I'm having a hard day. Because I think sometimes like it compiles so people feel hard, and then just be like, well, now I can never get better again.
Yeah. And the reason I say it that way is I don't want you to be afraid of stress.
Yeah.
Because stress is a normal, like it's not a problem. Just like anxiety is not a problem. What we want to keep remembering is it's all about our response to our distress. That is literally, if there's like one main like thing that you need to track, is when I have distress, you might have 10 out of 10 or 0 out of 10. But what we want to look at more is, how am I responding to it? What is my reaction to it? What relationship do I have with that stress? Am I trying to get rid of it, make it go away? Or am I trying to like go back to suppressing thoughts? Or am I using skills where I'm observing it, allowing it, having a willingness to have it, tolerating it, using your skills to manage it?
Yeah. A, I love your jacket, and B, I love your nail color.
Oh, thanks.
I was like, ooh.
Yeah, actually, it just got cold in here, so I just bought this big fluffy jacket. I wish you guys could all feel it. It's like, I feel like I'm like, it's the softest thing in the world.
That was my office last night. I was doing pre-stuff or post stuff for the conference, and I was just sitting there, and finally I was like, I have to leave. Like, my house has heat. This place doesn't. I'm about to die.
Yeah.
I wanted to throw this question up. Debbie says, I have a son who's 26 with OCD and does not work and doesn't like to go out in public. We talked a little bit about it with another parent, but in general, what do you kind of see when you have a client come in and this is their life? What do you kind of see the role of the parent is in a situation like this?
Well, again, have a conversation with them on whether they're willing to get help. And get them as much help as you have the resources to do so. Because if your son is, sounds like not going out in public, maybe agoraphobic, doesn't work, we want to get them back to like a baseline of functioning, and treatment is going to be a big piece of that. If they're willing, do find someone in your area, or as Chris's mom did, be as resourceful as you can at finding people who can get him the care that he needs. Now, if he doesn't want treatment, then I would probably pivot to more of a SPACE model. SPACE is a specific treatment where we work at you as the family member reducing any accommodating behavior and not engaging in compulsions. And then if you can, continue to attune to your child. Try to get them even little things like engaging back in hobbies. Even if they can start to do the laundry and start to see if they're, we start baby, right? We start baby steps. So what can we do together? If you have a nice attuned relationship where you're listening to them, you're hearing them, you're respecting them, you're genuinely caring, talking with them about other things within the house that can get back to, keeping them a little busy and out of their OCD.
Yeah. I'll just throw up, Debbie. I'd already put it up, but I'll just throw up. So I run a free family and loved ones support group every second Saturday of the month. It's one of the largest in the nation, and it's open to anyone from anywhere. We always have guests on. Kimberley Quinlan was a guest about 2 months ago. You can just email us and ask to be just, can I get the family group link? So just in the subject, just write family group and then ask. And it's for loved ones as well. So those that are watching that have a spouse or, are a grandparent or anything, it's an event for anyone. Yes, we do remember you, Beth. I know you've had some wins and sometimes it's been hard. I don't know if you watched what Kimberly and I were saying earlier. Always remember, things don't have to be done overnight, so slowly kind of pulling back. One thing that OCD does is it kind of gives us like a snapshot, right? I mean, I think I'll never forget, I was in my bed during right when the pandemic started, and I was looking up information because I'm like, I got to help my clients. I got to talk about what's real and not. And there was a video of a guy and he was like wiping down his groceries and he had this whole routine. And then I was just like, I don't know, this just doesn't feel right. I was like, I did that when I had OCD and I can't do that. And I remember like after a couple months, they kind of debunked that. And when they really understood COVID, they're like, oh, this is an airborne. That's why the masking is important, the distance. This isn't something that we're getting off of subject on top of surfaces. And I think the rest of the world kind of moved on, but I hear people with OCD still stuck because one thing that OCD does is it rewards us for being extra safe. Yeah. But I think one thing I wish my therapist would have just said bluntly to me back then that I said bluntly to myself is actually all the things I did because of OCD, it didn't make me 0.0001% safe. It was just a lot of extra busy work. Yep. So I hope you can work on that, Beth.
Yeah. I remember that, Beth. I remember sunning. We would get library books during COVID and we would sun them for 2 days. Because I think we'd read something that the sun would kill it off, like back in the very early. And then when you stop doing it, yes, there is that first couple practices where your anxiety will be 10 out of 10 because you've built safety around this behavior. So use it as an opportunity to practice, can I navigate that wave of anxiety and stay, knowing that this will get easier with practice?
Yeah. We get a question that says, is planning future schedules important for improving OCD? Lately, I've been gradually trying to make plans for the future.
Yes. I mean, I would, okay, so there's always going to be a caveat to things, but I'm a big believer in having things to look forward to and structure. OCD will totally take over your life if you don't have structure, and depression will take over if you have nothing to look forward to. So I feel like they're protective factors for you and your recovery. Now, of course, OCD can always find a way to get in and take things over. So we don't want it to be scheduling little baby too much excessive, but absolutely activity scheduling. I'm a big believer in time management for OCD. I actually created a course for people who had, and I'll tell you why. I'll tell you the main concept. You don't have to buy the course, but the main thing is you must also schedule your sleep and pleasure first. Right? Often we schedule everything OCD wants us to do and everything that we need to get done. And then we're lucky if we get pleasure or any sleep or anything enjoyable. And so flip that. Identify how much sleep you need. Make sure every week you've got at least one thing scheduled pleasure. And if OCD is taking you from things you love, schedule pleasure every day.
Yeah, you said it brilliantly. I mean, you have to have structure and you have to have hope and you have to have future plans.
Yeah.
I'll answer this one real quick. Dwen, they were on Zoloft. It was working really well, but they had physical issues and Zoloft stopped working. every second Wednesday of the month, I have on a psychiatrist. So please, please, please come back. This would be better asked for them, but really work with both your medical team that is dealing with your physical health stuff, as well as your psychiatrist to say, hey, for whatever reason, Zoloft stopped working because of the physical health. Is there a different SSRI, maybe an SNRI? The IOCDF put up their treatment. I think it's iocdf.org/treatment or treatments. I'll have to memorize that, but they put up, there's a lot of other adjunctive medications that can work that maybe will work better than Zoloft. If if it stopped working, there's also other things like TMS. So definitely come back second Wednesday. We'll ask a psychiatrist, but check out the IOCDF webpage. That might give you some ideas of what you could do instead of Zoloft. So I'm sorry that happened though. This is a good question. Could you share your thoughts about using sleep as an avoidance? My 22-year-old son will sleep late into the afternoon.
Yeah. It's common, especially if there's coexisting depression. Because if you're depressed, you could sleep all day and still feel exhausted. And so, again, we've given some resources. John Hirschfield's books, Alec Pollard's book would be really helpful. Again, you could discuss with them whether it's helpful for you to, intervene by waking them up. But I do think that if they're doing that I've had multiple clients who've done that, it's really important that they get mental health care and to help them find a plan to manage that and using exposure and response prevention so that they have some mastery over the things that they're avoiding.
Yeah. Sleep is a big avoidance. I always say it's sleep, alcohol, drugs, scrolling on your phone, and TV. Those are like the top 5 people will do instead of, face the world.
Yeah.
Okay. Is learning online about OCD and how to help and understand it as good as talking to a therapist? Because I can't afford it. I don't have insurance. Over the last 3 years, I've learned so much online.
Yeah. So I've done a lot of research. There is research to show that self-help models can be very effective, and for some people work more effectively, especially for those who do not have access. I'm biased though, because I have a full online program, but I made that for people specifically in your situation. So here is my way of explaining it to people. If you have access to a therapist, by all means, take that. But if you don't, you still have a lot of hope by using self-help models. That may be an online course. It could be a workbook. It could be support groups, even just listening to this type of talk and getting information, hearing different ways of coping with different conditions. Even if it's not your exact type of OCD, the concepts are going to be the same. So I 100% still wholeheartedly believe that, and I know of some of our students, many of our students who have made massive progress without having a therapist. It's not ideal, but it's still 100% doable. And so I want to give you some hope there that it's still possible. But yes, do get super plugged in. Stu Ralph's OCD Stories is really important. I have a podcast. There's quite a few good podcasts out now if you just put in your search bar OCD and continue learning, hearing of other people's stories. You will get there, but it just, and gather your support team around you.
Yeah, the only caveat I'd add is just make sure you know the source. Unfortunately, a lot of people now that aren't really good providers of information are making courses and things like that. But like somebody else said in the comments, when you have people like Alec Pollard writing a book, or you have a podcast by Stuart Ralph, who's both a clinician with lived experience, or Kimberley Quinlan, or Your Anxiety Toolkit, or I know that Liz McInvale, who's, a PhD, has a podcast. Like, it's important to just make sure. Kimberley Quinlan does have CBT school. I've been honored to do both a training for people with body dysmorphic disorder as well as clinicians on how to treat it. And there are people that will use those kind of programs. Yeah. And the good thing is, let's say you get to a point where you really can manage it, but maybe you just need a therapist to hold you accountable. Yeah. If you can't find someone, that is an OCD specialist, even if you found a general therapist that maybe has a sliding scale and says, look, don't try talk therapy on me. I'm doing these programs. It's been helping. I just need you to make sure that when I come in next week, I've done these 7 things. And if not, I need you to hold me accountable. I mean, if you can, but in general, there's some good self-help stuff out there.
Yeah.
In the last minute, to take us out as our final thought, let's answer this question. It's sweet. I like it.
How are you feeling with 2026? I'm so excited for 2026. I am working on so many projects that I can barely stand how excited I am. And what are you taking into this holiday? I'm actually going to go home and visit my family.
You're in Australia?
Yeah, my dad has dementia, and so I really feel like I want to get this one holiday in with him, before he continues to decline. So thank you for asking. It's going to be a hard holiday, but I'm so grateful we have the opportunity as a family to go home to Australia for Christmas.
Aww. Yeah, I mean, I'm really excited. One thing I'm excited about is I have an uncle with special needs. He has an intellectual disability, and my grandma was taking care of him. He lives in independent living, but needs a lot of support. My grandma was taking care of him, and unfortunately, when she passed, my dad and my uncles do care about him too, but my sister and I care about him a lot, and we're like, where's he gonna be? And da 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 da. My mom was so sweet. It's not even her brother, and my mom was like, he can come over to our Thanksgiving. So as long as my Uncle Kirk has somewhere to be, that's what means the most. But for me, just spending time with family, that's what's always been really, really important. I'm Greek, and we're crazy about family, so it's been important to me. But I think too, and we're going to talk about in the live stream next Wednesday. Holidays are fun now, but man, holidays were hard and tough.
Yeah.
When my OCD was the worst. Intrusive thoughts about family members struggling to leave the house on time, being at somebody else's house, or them coming over with contamination. So we'll be talking about that next week. But if OCD impacts your holidays, you're not alone. It's common for people.
Yeah.
All right. What's your final sentence or word to take us out?
Oh my gosh, I'm just sending you so much love. I really am. That's all I can really think of right now. Just please be gentle. You guys are doing so good. Thank you for spending your really valuable time with us. I know how valuable it is. And so I'm just sending you so much love today.
Yes. Well, thank you so much. Remember, you can always go to iocf.org for resources. I want to shout out Kimberley Quinlan. I look forward to every third Wednesday of the month. I sent the graphics early. I'm like, we're doing this next week. I'm so excited to get to see you. But we'll be here every third Wednesday together. We really appreciate it. You guys have been so kind and sweet in the comments. So we read them, and it really means a lot that you said these nice things and to each other and offer support and community to everybody. And yes, Colleen, please come back. We would love to have you back. That's so sweet. All right, everyone, remember, OCD, what I always like to say is OCD is not reality, right? Your life, your values, who you are, and who you and what you want to accomplish is. So just don't let OCD slow that down. So we're happy to have you. And Kimberley, what is it a good day to do?
It's a beautiful day to do hard things. Let's go.
All right, take care, everyone. Have a great rest of your day. It was good seeing you. Bye.